Hello, everyone. Thank you for joining us. We're getting ready for a wonderful question and answer Q&A session tonight. So get your questions ready. We're going to be discussing body contouring procedures. I'm Dr. Deigni. I'm a board-certified plastic surgeon, and I practice in Houston, Texas. And my signature procedure is the drainless tummy tuck. So whenever I do my body contouring procedures, I don't use drains. And it makes your recovery a lot easier and smoother. You don't have to worry about the drains poking at your skin, tugging at your skin, getting clogged, or even being removed a little too fast or too soon. And you end up with some fluid collections and seromas that need to be drained. So go ahead and share the link with your friends. Let them know that we are live. We're going to be talking about mommy makeovers, breast reductions, breast lift, breast augmentations. We can do breast augmentations with breast implants or fat transfer. We're going to be talking about Lipo 360, BBLs, and anything that you guys are interested in as far as aesthetic plastic surgery. So don't be shy, ask your questions. If I don't get to your question tonight, please go ahead and DM us. Also contact us. Our phone number is 281-724-3138. And my patient coordinator, Lina, will reach out to you and we'll be able to answer all your questions and get you in for your consultation. If you're out of town, out of state, and are not in Houston or even so in Texas, we will most likely start with a virtual consultation for you. So we offer those. And we look forward to meeting you. We had quite a few today, which was fantastic. And always appreciate you guys reaching out to us, booking your consultations, and then booking your surgery. So tomorrow, I've got a wonderful procedure that I'll be discussing as well tomorrow. But tomorrow morning, I'm going to be doing a combination of a Lipo 360. So I'm going to be able to actually contour the body, harvest the fats. I'm going to do some fat transfer to the hip dips. My patient is complaining of some severe hip dips, so we're going to go ahead and contour that and also put some in the butt area. So with the fat transfer, it doesn't necessarily all have to go in the buttock area. We can transfer it to areas where you feel you're lacking projection. So tomorrow for my patient, it's going to be mostly in her hip dips. On top of that, we're going to do a combination of a breast augmentation and a breast lift. So we're going to be using breast implants. I use silicone gel implants, such as the gummy bear implants, to give volume. But then with time, most patients will complain of some sagging of the breasts. So we need to actually do a combination of the lift with the implant. It's going to be a wonderful transformation for her. Grenadina 15, is getting a tummy tuck a few days after running a marathon okay, in your opinion? I mean, a marathon is a really long distance to be running. I guess it would depend on what your level of fitness is. I would probably give myself a couple more days than maybe like a week or so to recover. There's dehydration, there's muscle breakdown, there's all that stuff. And then getting a tummy tuck after that, you're going to be recovering from that. So I would probably wait a little longer than just a few days. But again, it all depends on your level of fitness. Discuss that specifically with your surgeon and see what would be the best recommendation then for you. But when is your marathon? I was impressed with people who actually are able to run marathons. Male Lady Goddess, can I be your ambassador, please? Come in for your procedures. We'll be happy to have you in. Grenadina 15. Okay, follow-up question. What do you recommend to get the best results for a belly button after surgery? So the main thing is to have a good technique to actually create your belly button. Now, some patients will tend to have some shortening of the belly button as they heal, so sometimes you need to do a little bit of a plug to be able to keep that open as it heals. But as long as you do a good technique with the belly button, there's really nothing else that needs to be done post-operatively. You just have to make sure that if there's any opening or wound healing problem, that you just take care of it with some local wound care. Soap and water mostly will do the trick, and also applying some antibiotic ointment. Ashley, I want my body done so bad. Well, contact us. We will be happy to book you for a consultation, and then we can discuss which procedures you would benefit from. Our phone number is 281-724-3138, or go ahead and put in your information in the bottom left of the screen, and we will be happy to take care of you. All right, so let's see here. Protect Your Own asking, please, do you have a non-surgical way of getting a flat tummy? It depends on where you start. There are some non-surgical techniques that are out there, but those are for very specific types of patients who don't have much excess skin, much excess fat. So it's very limited in the approach that they can do. So you got different machines that can help stimulate some reduction of the fat and also stimulate muscle buildup. But if you have separation of your muscles, if you have an overhanging pannus, if you have a lot of excess fat, the tummy tuck is pretty much the baseline. All of these other techniques are trying to produce results that the tummy tuck does. So the tummy tuck is the baseline, it's the gold standard. So it all depends on what you start off with. Come in for a consultation. We'll be happy to examine you and see. Click at 7 notes. Can you pin my question? Okay, I haven't seen your question, so post it again. It hasn't come up. Sometimes TikTok will hide some questions, so definitely repost your question if I haven't answered them. Grenadina's 15, March 16th. I've been a runner for 10 years. It will be my first full. Whew, okay. Well, congratulations, and wish you well. But please, I think because of the risk of dehydration, muscle breakdown, and things like that, give yourself more than just a few days to recover before you go in for a tummy tuck procedure, just for your benefit. Because a marathon is a long distance. It's a lot. I don't run marathons. I am I used to run sprints. I used to run in the Division I track and field at Georgia Tech, where I went to school. And so I'm more of a sprinter. So I do a short distance. I do a 400. I can maybe give you maximum maybe 3 miles at a fairly good pace, but I would never get to the marathon distance. So much respect to you guys, and have fun and enjoy. Protect your own. Follow-up question, please. I'm scared of surgeries and non-surgical ways to get a flat tummy tuck. So it all, like I said, hey, what's up, Joe? How you doing? Thanks for tuning in. I hope you're doing well. I'm live taking questions for my patients and my followers, talking about body contouring procedures. So love what you're doing. Keep doing what you're doing out there, okay? And thank you for tuning in. Beautiful baby that you got. All right, so let's see here. So for a tummy tuck, like I said, I've operated on patients who are very scared about of having surgery, and they have done extremely well. So it all depends on what your goals are, what your overall health is. That's the main thing. If you're healthy, undergoing general anesthesia is very safe. So we can definitely discuss things with you to try to get you to feel more comfortable in doing your getting your procedures. Okay, inviting me to co-host tonight. All right, let's see here. Tay, do you offer virtual consultations? Yes, I offer virtual consultations for my patients who are out of town, out of state, and who can't come to Houston for their procedures. Oh, sorry, for the initial consultation. But definitely, we will do a virtual consultation for anybody who would prefer to have that. And then we will definitely meet before your surgery, you will come to my office so that we can meet in person. I can examine you as well. So that's typically a day or two before your surgery. So we do everything to help you guys. Thank you very much, Joe. I appreciate it. Yes, we are working hard, and thankfully our patients are very, very pleased. Keep up your good work too. I really, really appreciate what you're doing. So for our patients who are out of town or even out of state, and sorry, out of the country, because we do have some people from Canada as well, we will offer those virtual consultations. So Campa is saying, is there any way of taking care? Thank you very much, Tropical Exotic Treats, for your rose. I appreciate it. I hope you're doing well. Is there any way of taking care of a neck band, of a classic turkey neck without surgery? Very difficult. Again, it all has to do with the amount of sagging tissues that you have. There are a few things that we can do to kind of help improve the results, I guess you could say. Tighten up that skin a little bit. There are some non-surgical treatments that are there, but it all depends on how severe your neck bands are. Again, the gold standard is surgery. So all of these are trying to get to what surgery can achieve, but fall short of the actual surgical results. So, there's always a balance that we can do. There are limitations. If you're okay with those limitations, then we can definitely do other treatments, such as like some radiofrequency treatments, or some other types of treatments that can help. Hey, LaWanda Wilson, thank you for joining in. It's been a while. I hope you're doing well. I think you'll be coming in soon for your follow-up appointment. So, okay, Protect Allen says, do I need a doctor's note or something because I am in Canada? So I don't know how things are done in Canada. If you need a note to be able to go see a plastic surgeon in Canada, I would just inquire, call up a plastic surgeon's office if you're planning on staying in Canada to get your procedures done or a consultation, do that. Otherwise, if you're wanting to have a consultation with us, you don't need a doctor's note. You can just contact us. A phone number is right there, or you can put in your information in the bottom left of the screen. We will reach out to you and then set up a virtual consultation so that we can do a treatment plan for you and see what's the best. All right, let's see here. Don Mitchell is saying, can you speak about general anesthesia? Yeah, so the majority of the procedures that I do, my patients will be under general anesthesia. Like I was mentioning earlier, as long as you're healthy, so you don't have any issues with your heart, you haven't had a recent heart attack or something like that, or even a previous heart attack, you're not at high risk of deteriorating during your anesthesia, then you will be able to move forward with surgery and be safe. Other things, say, for example, we talk about medical conditions, right? To make sure that people are safe. We want to make sure that any medical condition that you might have is optimized medically and does not preclude you from undergoing general anesthesia. So things that would pretty much be a hard stop is a heart attack. You've had a heart attack. You have congestive heart failure. You are severely impaired in your breathing. So you may have severe COPD and are on 24-hour oxygen and stuff like that. There are certain things pretty much that will really make you not a candidate for these procedures. But if you're a healthy person and you don't smoke, you don't have any medical problems that are hindering you, you should be extremely fine and safe to undergo general anesthesia. Of course, we do testing, and we get more information about your medical history when we discuss it with you. But general anesthesia is fairly safe for the majority of patients in the right candidates. Now, the type of anesthesia that we use at the surgical facility where I work and operate is called total intravenous anesthesia. So they don't use gases, and that really decreases your risk of nausea, vomiting waking up and being in a little bit more pain than when we do the total intravenous anesthesia. So everything is done through the IV to put you to sleep. And of course, they give you oxygen for you to breathe, but they don't give you any other gases to actually induce the anesthesia. So it's very safe, and our patients do extremely well. So keep asking your questions. I appreciate it. And share the link with your friends, okay? Let them know that we are live. We would love to be able to have a great session tonight with questions. Guys on Instagram as well and on YouTube, post your comments and I will answer them. Luminati, can you talk about lipo to the abdomen when doing a tummy tuck? Do you do it? Yes. So the liposuction to the abdomen, I do it in specific areas. I do it on the outer parts of the abdomen, top and bottom, but I don't do it in the middle part. In the middle part, I don't do it there because the blood supply, when I do the tummy tuck, the blood supply to actually keep that flap alive comes from that middle part. So to minimize the risk to that blood supply, I don't do the liposuction in the middle, but I will do it on the sides and give you a nice contour. So a little bit of mild edging, depending on your body habitus. And if we want to accentuate the contours, then I'll do it on the sides and also all the way on the bottom. And then I typically will do also some lipo 360 if you need it, which will include your bra line, your lower back, to really contour things, and your love handles. Great questions. You're very welcome. Protect your own. Hope everything's going well up there in Canada. Okay, so great question by user long number. Does the body contouring price is the body contouring price based on the individual? Yes, it is. So it all depends on what specific procedures you want to include in your body contouring procedures. There are small variations. Say, for example, a patient who's had previous liposuction, doing a repeat liposuction will be harder because there's already scar tissue that's been developed. That tends to take longer. So we have to take into account the fact that it's going to take longer because anesthesia and facility fees are going to be higher. And we have to be able to cover those fees as well. So that's why individual pricing and quotes will change by a little bit. It's not like it's going to be $10,000 difference between somebody who's never had liposuction before and someone who's had liposuction for a lipo 360. That would be unreasonable. I'm just talking about a couple differences in the numbers between the quotes. But yes, we individualize the procedures based on your specific needs, your body, your medical history, what types of surgeries you've had before, if you have a hernia or not, things like that. So the quote will be based on that. Glad to hear you're doing great, Lawanda. Looking forward to seeing you again. All right, let's see here. To protect your own, I want to come to the US and said, okay, no, not a problem. So put your information in the bottom left of the screen there. My patient coordinator, Linda, will reach out to you. We'll get a little bit more information about your medical history, see how you're doing, and then decide when we can get you in for a virtual consultation, and then we'll go from there. Hi, Jen. Thank you for tuning in. Ask your questions. We're talking about body contouring procedures. I'm a board-certified plastic surgeon. I'm Dr. Deigni, and I practice in Houston, Texas. And I'm happy to have you guys come in for your consultations in person or virtually if you're out of state or out of town or even out of country. Luminati is asking, do you recommend a BBL if the patient is on GLP-1 after surgery? I've been told I'll always be on it. Oh, okay, I see. You should be able to wean off your GLP-1 eventually. But regardless, if you're getting a BBL and you're going to be on GLP-1 medication after surgery for long term, as long as you're not losing weight, you're just maintaining your weight, that should be fine. Because the weight loss is going to affect the results of your BBL. So as long as you're on like a maintenance dose and you're not actually dropping weight, 5, 10, 15, 20, 25 pounds after surgery, you should be able to actually maintain your results long term. Okay, so yes, I just answered that question there. So like I said, as long as there's no major weight loss, you should be fine. Dr. Wilson, okay, sure. Let me repeat this again. Can you talk through why no liposuction on the stomach when doing a tummy tuck? So I do liposuction on the stomach. It's just in certain parts of the stomach, I don't do it. So I will do liposuction on the outer part of the stomach. So this is where I'll kind of like highlight the size of the ab muscles. And also on the bottom part of the stomach, I'll do liposuction. I won't do liposuction right here in the upper part and in the middle part, because that's where the blood supply comes to feed this whole flap. Because we make the cut down here, so there's no blood supply down here. The blood comes from up top, so it has to be able to come down and feed all the way out to where that incision is. If we disrupt that blood supply, you're at a high risk of actually not being able to heal here, and it's going to give you some necrosis, some open wounds, and that's why I don't do that, for safety reasons. All right. You're very welcome. Very welcome. So, Luminati, thank you. What's your outlook on plus size tummy tucks? Okay, so for me, I want you to be within 10 to 15 pounds of your goal weight. The max BMI is 35 for these procedures because it is going to bring you into a zone where there's less risk. There's still risk of wound healing problems, surgical complications, things like that. But the risk gets even higher if your BMI is much higher. So a BMI of 40 or BMI of 45, you're at a much higher risk of having these wound healing problems. So we try to control that weight and come down to a safer zone. So my cutoff is 35, and anything less than that is much better. You're very welcome, Miss White 78. I'm glad that you're appreciating the information. I do these live sessions every Tuesday and Thursday, time permitting, if I'm not operating, recovering from surgery, long days of surgery, or if I'm not traveling. So, I'm able to do that tonight as well. So that's good. And I usually do these around 7 p.m. Central Standard Time. And I'll try to stay on for about an hour, depending on how many people are on and then what questions we have. Elise Tessere. Good evening, or Elise Tessere. Good evening, doctor. Can we who are in Africa come and have liposuction done at your place? Yes, you can. Absolutely. People can travel from abroad to come in to have surgery with us. We will start with a virtual consultation. However, I know people have asked if we can send a letter of invitation. We cannot do that. You have to be able to find on your own terms how you can get to the U.S. To get your surgery done. So definitely, if you're able to travel to the U.S., by all means, contact my office, and we will be able to coordinate your procedures with the time that you're actually here in the U.S. Visiting. All right, Betty OT6 is saying my arms and my stomach. How much? So for specific pricing, please contact my office. Our phone number is 281-724-3138, and you can put in your information in the bottom left of the screen. There should be a form where you can actually contact us as well. Put in your information. We will reach out to you, okay? I don't have the pricing. We will be happy to give you an estimate so that you can budget, but you'll get an actual quote for your particular surgery once we've done the consultation, so I know what type of surgery I need to do exactly. There are different types of arm lifts that we need to do. We could do only liposuction. We could do surgical excision. It can be limited here. It could go from the elbow to the armpit. It could go from the elbow, armpit, and go down. So that will change the price depending on what exactly you present with and what your goals are. So I can't give you a price without having seen you or examine you to know what we're going to be doing. But we can give you some estimates so that you have an idea of what the budget is going to be like. But the specific pricing for you will be once I actually am able to examine you, so we can give you a much better, accurate pricing. Yeah, but I can tell you that, for example, the drainless tummy tuck that I use, that I perform, it starts at $11,500, and that includes surgeon's fee, facility, and anesthesia fees. Luminati, do you suture while closing or use glue? I suture. So I put meticulous stitches everywhere to close the space up so that you heal well. And just as a dressing, so to cover up the incision, I'll put some glue. But that glue doesn't serve to actually hold it. It's just to cover it so that it doesn't get dirty. And I'll also put some tape over it. And I'll remove that about 1 week after surgery. So the main strength of the repair is all through the suturing that I do. Great questions. You're very welcome, Betty OT6. So contact us. We'll be happy to take care of you. You're very welcome, Elise. And we hope we can take care of you. Just continue to participate and at least get all the information you can get with us. Like I said, I do these live sessions every Tuesday and Thursday, starting around 7 p.m. Central Standard Time. And my goal is to educate and provide information so that you're well equipped when you actually go in for your consultations. Whether you choose me or not, we hope that you will choose me as your doctor. But if not, at least you are well informed and you can ask appropriate questions and make sure that whoever you choose is qualified to do the procedures. And we recommend a board-certified plastic surgeon who specializes in these aesthetic procedures, and that they have adequate facilities and you love their before and after results. And also you feel comfortable chatting with them, because there are some people that have come to my office and have had surgery with me after they've gone to other places where they actually never got to meet the surgeon. And even the day of surgery, they're going to be taken to the operating room without even having met the doctor. So I definitely recommend that you don't do that. Talk to your doctor who's going to actually be operating on you at least once or twice before your day of surgery. It's very important. MIAP is saying 148 pounds, 5'5". Perfect. So at 5'5", you will definitely qualify weight-based for a BMI that's lower than 35. And we will be happy to take care of you depending on what procedures you would like to have done. So put in your information in the bottom left of the screen. We will go ahead and contact you and get you on the books for your consultation and your surgeries. Toya Mini Weather is asking, do you accept Medicare? No, we do not. We don't accept any form of insurance. All our patients pay out of pocket. The procedures that I do are not covered by insurance. Maybe the paniculectomy part of the tummy tuck may be covered by some insurances, but even breast reductions really aren't covered anymore. It's very difficult to get them covered, but I don't take insurance. So my patients will pay out of pocket. We do offer financing options. We got 4 of them: Cherry financing, Patient Fi, Alpheon, and Care Credit. All right, let's see here. Samantha Cigara 69, implants. What are your thoughts? So, hey, Salbin, how are you? I hope you're doing well. I see you on social media and love seeing your pictures, and I wish you well, okay, and your family too. Implants, what are your thoughts? So for breast augmentation, yes, implants are phenomenal. They're great. I use the smooth silicone implants. I stay away from the textured one because they are they have been linked to a rare form of cancer that can happen. If you do have that, we remove the textured implant, clean out the pocket, remove the scar tissue that formed around, and you should be fine. But I do the smooth round silicone gel implants for my breast augmentations, and most patients do extremely well. You will have to probably get those replaced at some point during your lifetime, but if you're not having any issues, any problems, you don't necessarily have to get them removed. Now, they provide a good amount of volume. Another type of augmentation that I'll do for my patients, if they don't want implants, or it'll be liposuction and fat transfer. So I do the liposuction to be able to harvest that fat, and usually I'll do lipo 360 to get a good amount of fat, and then I'll transfer it to the breast. So I've done combinations of breast lift and then breast augmentation with the fat transfer to give you a nice, natural looking result. And patients are very pleased with it. So if you're wanting to go, say, for example, from a B cup to a C cup, we can do that. Or maybe a C cup to a full C or a small D, that should be fine, depending on how much fat you have. Very seldom will we try to go from like a B cup to a D cup with just fat transfer. I don't think that's reasonable. It's asking a little bit too much of the body. But if you want to do that, then an implant will probably be your better choice, because we need a lot of volume, and that fat needs to be able to heal. That area needs to be healed to be able to heal. If we were to put a lot of fat, maybe some of that fat wouldn't survive. All right, so let's see here. Hello. Barry Kim 2017. Thank you for joining us. Always a pleasure. Denny is asking, what procedures can be done for legs that look like cellulite but is not? It all depends on, I need to be able to examine you and see, because I need to palpate the skin, look at the tissues, see what needs to be done to actually improve that area. I have some women who will have some dimpling and sagging of their tissues in the outer thighs and lower buttocks. And when I do a butt lift and a hip lift, so like a combination of a body lift with the drainage tummy tuck, it actually helps to really smoothen out that area and removes those cellulite looking zones. So it all depends on what you present with. I would have to see you to see what needs to be done. Luminati, follow-up question. How can you tell if someone needs muscle repair or not? And can you talk about a Mons lift? Absolutely. So typically when you come in for your examination, for your consultation, we talk, we get we go through your medical history, your desires, your aesthetic desires, what you want to have done, and then I examine you. When I examine you, I can actually palpate where your muscles are in your belly. So I feel your belly, I feel your tissues. I want to see what the tissues feel like, how much fat layer you have, how much loose skin you have, if you have stretch marks or not. And then when I palpate it, I can also feel where the muscle edges are and whether or not you have separation that will be that will need to be repaired. Now, not everybody will, I won't necessarily be able to feel it in everybody beforehand, but definitely when I do the surgery, I lift up the fat and skin layers and I actually see your muscles. So that's it's direct vision. I look at it, I measure the distance, and if it's more than usually 1 centimeter or 2 centimeters, then I will actually fix it, because a 3, 4, or 5 centimeter separation is too much. We have to bring it back in to give you better function and a flatter belly. So it's through visualization when I actually operate as well. But some people we can feel beforehand. Now let's talk about the Mons pubis lift. So a lot of women over time, and even men, will have descent of that suprapubic area. So the pubic area above the labia majora, above the clitoris, above the penis in men, those areas, it can fill up with fat. It can start to kind of sag. And so when I do the tummy tuck in my patients, and 99% of my patients are women, I will actually lift and contour that area. So I'll make an incision. So the cut from the tummy tuck, when I go up, that's the belly. When I go down, it's the Mons. So I go down, remove some of that fat, contour it and soften it, and then I and I tie it up with the upper part of the tummy, and that really gives a nice contour to the area. That's how I do the monsplasty or the mons lift. And I do that in all of my patients. It's part of my drainless tummy tuck technique. Hey, Laura, how are you doing? It's nice to see you. Looking forward to your procedure. You're very welcome, Delia. Absolutely. Thank you for your question. Okay, is there a flat fee for the initial consult? Yes, it's $150 to book your appointment with me for your consultation. And we'll be happy to accommodate you. I see patients on Mondays and Thursdays. So today was my office day, and I saw quite a few virtual consults today as well. So definitely, if you're not in Houston or Texas or able to actually make it to Houston for your consultation in person, we would definitely start with a virtual consultation. So contact us, put in your information in the bottom left of the screen, and we will be happy to answer your questions and get you in for your procedures. Vicky Aisu is asking, what is the monsplasty? So the monsplasty is what I just talked about. On your belly area, you've got your excess fat skin that bothers you. You've got the pannus, the overhanging belly. Below that, you've got the mons pubis area. So that's where your pubic hair is. That's called the mons pubis. You're very welcome, Delia. Looking forward to taking care of you. That area is the fupa. There you go. Illuminati is saying the fupa. It's another term for that area. That's the layman's term for that area. So where your pubic hair is, a lot of women will have a lot of, not just women, men too, but I'm saying women because 99% of my patients are women. But a lot of people will have a lot of sagging or even some excess fat, and it just kind of flops down. So if you've had a C-section, you'll see that you get that belly, right, that overlaps that scar tissue, and then below that scar tissue you have another kind of like mound. That's the fupa area. That's the mons area. And in my tummy tuck, what I do is I actually fix both the tummy tuck, the tummy area, and the mons area to really make it nice and flush so that it doesn't look weird. Because if you only fix the tummy part, you leave the mons fat, it's going to look very weird. So I actually fix both at the same time. So that's what it is. Yes, Illuminati, the fupa. Yes. Samantha Segara 69. Okay, I'm 54, weigh 170 pounds, great health, mother of 3, and granny of 2. Wonderful. What do you think of a mommy makeover with lipo? Okay, so 170 pounds. How tall are you? You know, as long as you're taller than 5 feet, you will be at a BMI that is okay for me to move forward. Now, the mommy makeover, it all depends on what you want done. Liposuction, we have to look at where your excess fat pockets are. Most people will be bothered by the ones around their bra line area, their love handles. They want to get more of that snatched look. They may have some excess fat in the mons area, so the fupa area. Or also in the belly. Now, it depends on whether or not you have stretch marks, if you have loose skin, you know, things like that. So you may benefit from the tummy tuck, which is a skin excision procedure, repair of the muscles, separation of muscles, transposition of that belly button, fixing the mons pubis area. So that all takes into account the front part of your body. And then the liposuction can be complemented to contour your bra line area, your back, your love handles, to really give you a nice contour. You could also want to have that fat placed elsewhere. It could be in your hip dips, around your butt area as well. So there's many different procedures that we can do for a mommy makeover. We just have to make sure that I understand what your aesthetic goals are, what you're trying to achieve, and then we can put together an appropriate treatment plan for you. liposuction may not be enough, in other words. Kali Dumar, what is the average price for that? So pricing, please go ahead and contact my office. Our phone number is 281-724-3138. And you can also put in your information in the bottom left of the screen. We will reach out to you and give you an estimate based on what specific procedures you want to have. But for an actual specific quote, I need to actually see you either virtually, and you'll send in pictures, or in person, and then we will give you a specific quote for your surgery, because it depends on the individual. So definitely give us a call. We'll be happy to give you an estimate for a ballpark number for these types of procedures, so that you have an idea kind of like of what the budget will be for you. Okay, Illuminati is asking, what are the main complications you see post-tummy tuck, and maybe why you'd see this complication? All right, major complications, I would say, the main complications. So what is typically common for tummy tuck? I would say in patients who've had massive weight loss. That's the second part of your question. And where would you see that? It's mostly in patients who've had massive weight loss patients. We'll have small areas where the incision may open up. So it's called delayed wound healing. Nothing big, not a big deal. You will heal. We increase your protein intake, make sure there's no infection that sets in. You keep things clean with soap and water and some antibiotic ointment. It could take anywhere between 2 to 3 weeks to heal, depending on how big that area is. That's typically the main complication, I would say, that you would see. Again, you have to make sure that you select the right patients. Now, if I don't operate on patients who smoke. I've had some patients who had some positive testing, or have smoked and maybe we didn't know, or even smoke after. That's not good at all. And then you'll come up with wound healing problems. So your incisions open up, the wounds don't heal well, things like that. If you have diabetes and you're not appropriately managed, it will probably take a very long time for you to heal, or you may not heal at all. So those are the types of complications that you can see if you don't do your due diligence to make sure that you get the right patients and get any medical conditions that they have optimized before you go ahead and do surgery on them. Lindsay Scott, can we prepay? Yes. So you will be, the way we have it, the quote is good for 6 months. So during that time, you can prepay, you can make payments regularly, but at 2 weeks before your actual surgery date, your bill has to be paid in full. All monies have to be received. So like I said, we have financing options. We offer cherry financing, patient fi, Alpheon, and care credit, or we also accept cash, cashier's check and money orders, and credit cards and debit cards. Of course, we also accept those. You're very welcome. You're very welcome, Kali Dumar. I hope this has been very helpful for you. So user long number is saying, is there an extra charge for lipo if I've had liposuction already? So I wouldn't necessarily call it an extra charge. The pricing changes because there is because of the fact that there's increased scarring, and it makes the procedure harder and also longer. So because anesthesia pricing, facility pricing is all based on the time of surgery, knowing that you've had previous surgery and scar tissue that's already there changes the quote. So for example, if a patient comes in and usually the procedure for the liposuction is about 2 hours, somebody who's had previous liposuction, it may take about 2.5 hours, maybe even 3 hours to do that same procedure. So that's where the pricing changes, because we have to take that into account. Hopefully that makes sense. Thank you very much, guys, for sharing the live link. Definitely let your friends know that we are live, and we're here to take your questions. Vicky Ayuso is asking, how do I pay installments before I come over for the surgery since I can't pay at once? Oh, call us, contact us, and we'll be happy to coordinate that for you as well. For people who are in Houston, usually they'll just pay, they'll come in and make like a money order, cashier's check deposits, and they'll do it regularly, or they'll bring cash. For those of you who are not in Houston or able to come in person, usually you'll just pay by credit card or debit card. You'll make some payments at your rate. That's fine. Excellent. Let's see here. Lindsay Scott. What if there are things we will do or not based on what we see type situation? That is something that you have to discuss with your surgeon. You have to discuss that specifically with your surgeon before surgery is done. I know back in the day, old school ways, the surgeon would pretty much do whatever needed to be done for the particular case, but that doesn't always turn out to be the right way to do it. So this is something that you'll have to discuss with your surgeon and be comfortable with the level of expertise and kind of like making sure that the surgeon understands what your goals are. So for example, if we go ahead and we say we're going to do a body lift or a certain type of procedure, right? But then we come in, we do the procedure, and then we see, oh, you will actually benefit from a different type of procedure. We didn't talk about it. We did not consent you on it. We would not do it. At least I would. Maybe some other surgeons would do it, but I wouldn't do it because legally we're not, I guess we wouldn't be protected if you were happy with the results. Definitely wouldn't be able to do that. It's very important to be able to discuss things. And I'm talking about things that are not life-saving, you know. So this is a different conversation than if you're going to have a medical procedure done. So if you're having like, you know, some type of heart surgery, or you're having some type of procedure that is medically necessary, that's different. There are things that they may see that they didn't foresee, but they have to do the work to be able to actually save you or do what needs to be. That's a completely different conversation. What we're talking about is cosmetic surgery. Say, for example, you say, and I just had that actually with one of my consultations today. They were telling me that their surgeon had put saline implants, right? And the patient wanted a certain volume. They didn't want to be too big. But then during surgery, the physician actually decided to put much more saline than what they had agreed on before, because they felt, you know what, this will look better and give you a bigger breast volume, because most women would like a bigger breast volume. And so the patient wasn't really happy with that. That's something that you have to kind of discuss, like I said, with your doctor, because my goal is, one, we want you to be safe, and then we want to actually deliver results that you want and are happy with. So that's right. But that's a good question. Discuss that in detail with your surgeon to see what those ifs and things like that will be like. For pricing, everybody, please go ahead and contact us. For the drainless tummy tuck, the pricing usually starts around $11,500. For an extended tummy tuck, it will be a little bit more than that. If you want to do the body lift, so it includes the butt lift and the hip lift, the circumferential tummy tuck is going to be more than that. If you want to add liposuction, it's going to, you know, add on to that. But we usually start at $11,500 for the drainless tummy tuck. Can you talk about lipo burn or fibrosis after lipo? How high is the chance? So for that, if your surgeon is not using the proper technique and is not careful, then yes, you can get a burn. Fibrosis will happen. It's part of scarring and the healing process. That's normal. So that's not an issue really, but it's more like the burns. That the burns is if you're not really paying attention, you're going too close to the surface, or you're going repeatedly in an area and not actually treating the full area. So that's more like a technique. And you have to be careful with that. The other types of burns that you get is if your surgeon uses a device that has energy, that heats tissues and things like that. You also have to be careful because you risk burning the patient. Jazzy Bea, do you offer surgery in the hospital? I do. So I offer surgery in the hospital for those who want to go to a hospital-based setting. I do 99% of my surgeries at a same-day facility, a standalone facility, and avoid the hospital, because in the hospital system, you have sick people, you have other people who come for other stuff, you've got potential for infection and other contaminations. So I typically avoid that setting. But if you would like and you prefer to be in a hospital setting, yes, I do offer that as well. Question by Candy. Do you do work on overweight people? I do. Yes, the max BMI for the majority of these procedures is a BMI of 35. So that is overweight people and obese people. But there is a cutoff. If we go too high, there's a much higher risk of wound healing problems. And I definitely would like to minimize that and help you get through your procedures well. Okay, Lindsay Scott has a great question. Do you ever do like front stuff and then back stuff after, or always all at once? I do all of the above. This week, I just posted a video talking about the procedure that I did on my patient. I think it was, when did I operate on her? It was yesterday. Yesterday, I operated on her. She had a previous tummy tuck. We had talked about doing a body lift, so the full tummy tuck, hip lift, and butt lift, but wanted to do just the tummy tuck first. So we did the front part. She's healed now, and now she's come so we can complete the hip lift and butt lift. So we can do it all at once, or we can do the front part first, let you heal, and come back and do the rest. So those are very good questions. Renee, would C-section be considered as surgery to factor in cost? Oh, you mean like you've had a previous C-sections? That's all included in the tummy tuck. So you've had a C-section scar. I don't really look at that necessarily as a huge surgery that's gonna put add 30 minutes or an hour to the procedure to really change the pricing. But I've had some patients who had significant C-section scarring. It does kind of slow down a little bit because you have to be very careful, make sure you're in the right plane, and remove that scar tissue diligently. But typically, it's very minimal. Actually, never even thought about that. I usually don't actually factor that in. It's more like if you've had multiple surgeries, you have a lot of scarring, or you had a lot of liposuction, because that really scars things down, and it takes time to get through that scar tissue. Those are more like the types of procedures that will probably add significant time to the overall procedure. Great questions. All right, let's see here. The Biancanella, not sure what to ask for since I just want to look and feel better. Okay, so contact us. Our phone number is up on there. It's 281-724-3138, or put in your information in the bottom left of the screen, and we will be able to discuss it further with you and kind of get a better idea of what you're wanting to have done, and we can kind of help guide you, and then work through different options to see what the best treatment plan will be for you. Okay. Jazzy Bay, follow-up question. Do you offer surgery in a hospital if cleared by a cardiologist? So it all depends on what your health conditions are. If you have severe health problems, you may not actually be a candidate for these procedures. So this is based on a individual decision. I'd have to see. We have to do a proper workup. If you have some kind of cardiac problem, we have to make sure that you're cleared by a cardiologist. EKG, stress test, whatever needs to be done. An echocardiogram, ultrasound, whatever needs to be done to actually examine your specific conditions, optimize them, and if you're cleared, then yes, we can move forward. If you want to have surgery in a hospital system, we can do it in a hospital-based system. Otherwise, I typically do it at the surgical facility. Okay. Yes. All right. So, Dora LA, thank you very much. Thank you for your comments, everyone. Thank you for your questions. Okay. So Dora LA is asking, will 360 be as good as a tummy tuck? So lipo. If we're talking about liposuction, lipo 360 is liposuction that removes fat around your belly area, your love handles, your back, and your bra line. That is different than a tummy tuck. So it all depends on what you present with. Say, for example, you have a lot of loose skin in your belly. You have an overhanging pannus. You've got some excess fat. You've got separation of your muscles. You've got stretch marks on your belly. Liposuction is not going to give you the same result as if you got a tummy tuck. So we have to make sure they're not the same thing. So we have to make sure that you understand that. And then through the physical examination, the consultation, and our discussion, I can understand what your goals are, and we can come up with the treatment plan that will best give you the results that you're looking for. Great. Put in your information in the bottom left of the screen there, guys. I appreciate it. We'll reach out to you and be happy to get you in for your consultation. If you're not in town, or if you're out of state, out of Texas, or even out of the country, we'll start with the virtual consultation. Karina Butler, how do you feel about doing revisions from other doctors' tummy tuck, like dog ears, crooked scars? I've done it. So you can come in, we can see what needs to be done. I've actually had some patients where I had to redo the tummy tuck. So it all depends on what needs to be done. But you're welcome to come in, contact us. And if we can do it under local anesthesia, remove dog ears and things like that, we can definitely do that in the office. We don't have to do it under general anesthesia. Ashley Woodall is asking, I've had 5 C-sections. Would that be an issue? Not at all. I've operated on patients who've had 5 C-sections before, multiple C-sections, hysterectomy. I've had patients who've had a combination of the C-section that goes transverse or horizontal, and C-section, emergency C-sections with the vertical scar, and on top of that, a hysterectomy scar. I've operated on patients who've had all 3 of them. So it won't be an issue. And we'll be happy to take care of you. Nadia Professional Shopper is asking, how painful is the thigh lift with lipo? Everybody heals differently. I've had some patients who've had no issues at all with pain control, and I've had some patients who wean off their pain meds usually within 1 or 2 days. I have some patients who wean off their pain meds around 5 to 7 days. Everybody's different. As far as pain control is concerned, we try to get your pain level to no more than 3 or 4 out of 10, so that you're actually feeling maybe some discomfort, but you're not in excruciating pain, not to a point where your heart rate is elevated, your blood pressure is high, you cannot get some rest, you do not feel good. We don't want that. There's pain medication that we can give, we can adjust things, and we do that for all our patients so that the pain level gets down to like maximum of a 3 or 4 out of 10. You have to be comfortable to be able to recover from these procedures. So to answer your question is, we will treat your pain to get it down to where it's a comfortable level for you. And everybody has a different threshold for pain. Okay, Kelly Mack is saying, I had a cerebral aneurysm 2019. Would this stop me from getting a tummy tuck? You would have to get medically cleared from your vascular surgeon to sign off on that to quantify what is your risk. If you're at very low risk of developing any kind of complications or problems, then you should be able to get a tummy tuck. But if they say you are high risk, then you would not be a candidate for a tummy tuck or a body contouring procedure. All right, let's see here. Okay, so Gloria Wallace says, I have a pacemaker. Is it possible for me to have plastic surgery? So that's a question that will have to be investigated much deeper at an individual level. We have to get your cardiologist to be able to quantify what is your risk. Can you turn off your pacemaker? If not, there might be some issues. You may not be a candidate to be able to undergo these procedures. Cooking with bread. Do you have any clinics in San Antonio? I do not. I am based in Houston, Texas. I have plenty of patients who come in from San Antonio, College Station, Corpus Christi, Austin, Dallas, Fort Worth. They drive in to see me and have surgery with me. So we will start with a virtual consultation for you, but I don't have any offices in San Antonio. Okay, you're very welcome, Ashley Woodall. Yes, we'll be happy to take care of you. Come in and see us. Like I said, I've operated on patients who've had all of those, and they've done extremely well because I can actually remove that scar and keep that scar tissue nice and low. And they're very, very pleased because they no longer have that. Okay, I had to let TikTok know that we were still live. We've hit the 1 hour mark. We're going to be closing shop soon. But yes, so I've operated on patients with all of that, and they've done extremely well. I keep the scar nice and low so that when you're wearing a bikini or a bathing suit, it's not visible. Cynthia Cortez is asking, I wasn't a candidate for the outpatient procedure elsewhere for amount of skin. I hope you can help. Well, it all depends on why you weren't a candidate. So if medically there are things that prevent you from actually being an ideal patient, then you may not be a candidate. But we can definitely investigate and see what those issues are, if medical issues that you might have. Chastity is asking, will insurance companies pay for this or some? So I don't take insurance. All my patients pay out of pocket. We have financing options that are available for them to use. Very rarely will I see an insurance company say that they'll cover a small part of these procedures. Probably like maybe the tummy tuck. They'll probably cover the paniculectomy part of the tummy tuck, but it's extremely rare. But I don't take insurance, so my patients pay out of pocket. You can discuss things with your insurance to see if they will reimburse you directly. We'll be happy to give you the CPT codes and diagnosis codes so that you can discuss that with your insurance, and if they will, then they will reimburse you directly. All right, let's wrap this up here. Edwards backup. Hello, I have back fat that I want lipo on. Will it leave loose skin? It depends. It depends. That's a good question. It depends on what your skin quality looks like, and I won't be able to determine that until I actually see you, or at least get some pictures if you do a virtual consultation. For that, what we would do is if there's no, if you don't want the bra line lift, we can always add the skin tightening procedure, Renuvion, also known as J-plasma, and try to get that skin to contract more and avoid placing the scar from the bra line lift. All right, I think I'm pretty much done with questions here. Okay, wonderful, Ashley. We'll take care of you. We'll take care of you. I've operated on patients who've had the gastric sleeve scars, the hysterectomy scars, and all that stuff. We'll be happy to take care of you as well. Kerry Gordon Chambers is saying, I have diabetes. and hypertension, can I get a BBL? You can, as long as those medical conditions are optimized. I've operated on patients who have had your conditions, diabetes and high blood pressure. As long as they're well medically managed, we can go ahead and get you a BBL. Oh, okay. Cynthia Cortez, I'm healthy, but she felt I needed to be in a hospital setting. Okay, interesting. So contact us. We'll be happy to see you and examine you and do the appropriate workup. And as long as you're healthy enough to proceed, we will be able to work on you and do it at the same day surgical facility where I operate. Like I said, 99% of my patient procedures are done there under anesthesia, under general anesthesia. Local anesthesia procedures I do in my office. For pricing, Yolande Enelis asking about the mommy makeover. How much? Mommy makeover depends on what specific procedures you add to your mommy makeover. It can vary. The pricing can vary from $15,000 to $30,000, depending on what procedures you actually add onto your mommy makeover. All right, everybody. Thank you very much for joining us. Okay, thank you very much, Bamboo Spa Massage. I appreciate you participating. She's saying, Doctor, excellent information. I've received several patients from your office. Excellent technique. Thank you. Thank you very much. Wish you well. Okay, guys, we are going to wrap up tonight. Everybody have a wonderful evening. Stay tuned. Tomorrow I'll be talking about the procedure that I'm going to be doing. Bright and early tomorrow, I've got a combination breast lift, breast augmentation with breast implants. I'm also going to do lipo 360 and fat transfer to the hip dips mostly, and a little bit to the butt to kind of contour everything. That's going to be a 4 or 5 hour procedure for my patient, and she's going to be very, very happy with the results. Have a good night. God bless you, and see you next time, okay? Bye-bye. Thank you, everyone. You guys take care, okay? Have a good weekend. All right, my YouTube family. Until next time.